Case 30. It's like an Easter egg.
So it looks like there's this kind of pink ball within a lumen with a little bit of a muscular wall, maybe.
Oh, good. I like that you brought that up because that is such a great clue. Sometimes we get something in a space and we don't know, is it a vessel or not? The best way to tell is go look, is there muscle around it, right? Because usually like a venous channel of some sort is going to have some degree of muscle. Now, there are some like thinner walled vessels that have very little muscle, like in malformations. But if you see a nice layer of muscle, then you know you're inside a vessel, right? Good. So yes, it's inside a vessel here, probably a big dilated vein. Okay, and so what is this stuff?
And then it's kind of at the periphery of this pink ball, there's like lines of more acute hemorrhage and then layers of fibrin. So the whole pink thing is probably fibrin. So the whole thing is probably a thrombus.
Very good. And I'm sorry I interrupted you, but I really like that you made the point of recognizing the muscle there.
Please.
I also like that you made the point about the blood, that, thrombus can have different stages of evolution within the same thrombus. So the early stage where you're seeing like the blood layered with the fibrin that's depositing, and then you can have other areas that are much more dense fibrin and less blood, and they may or may not begin to have histiocytes and endothelial cells and other inflammatory cells trickling into the middle of them. And this is when the thrombus is starting to undergo organization, right? And technically thrombus is when it's in a vascular channel. If we had this same process, say in soft tissue without a vascular lining, then that would be a hematoma, right? And sometimes we just get a chunk of fibrin and we can't tell. So then I could say organizing fibrin. And I don't know if it's a thrombus inside a vascular thing, or it's a hematoma, or an old seroma cavity that bled into itself. I don't know, right? Unless I see the context of what's surrounding it, all I can tell you is this is benign organizing fibrin, and I don't know what kind of space it's arising in. So that happens sometimes where this stuff gets shelled out and it's not clear from that. And that's the way I end up signing those out, is organizing fibrin. And if there's really just a ball of fibrin with no tissue around it, I'll say there's no normal tissue. I just have fibrin and I can't tell if it's in a vascular space or in soft tissue or what. So, and then here there's hemosiderin, and it can get cellular. You'll see some mitoses because these are actively growing endothelial cells. You can begin to see little vascular lumens and the little papillary formation of papillary endothelial hyperplasia. Sometimes you see it, sometimes it doesn't produce it. I don't know why some thrombi do that, others do not. In this case, I don't know if this is in like a vessel that's had some aneurysmal dilation, or if this is actually a vessel that's part of a malformation. I'm not sure, but it's a dilated vein with a large organizing thrombus in the middle. And that's what we've got here. Look at that nice layering of the blood and the fibrin there. Very nice.